What is folic acid? Folic acid is a B vitamin and it is a synthetic form of folate that is important in red blood cell formation and for healthy cell growth and function. The nutrient is crucial during early pregnancy to reduce the risk of birth defect of the brain and spine. Why folic acid is important? First, preventing anemia. Folic acid aids the body in producing red blood cells as well as maintaining new cells. Second, prevent birth defect. Folic acid helps form the neural tube. It helps to prevent some major birth defect of the baby's brain, anencephaly, and spines vena bifida. Sources of folic acid. Folic acid can be found in green leafy vegetables, fruits, nuts and legumes, and fortified foods such as rice, pasta, bread, and breakfast cereals. A diet lacking foods rich in folic acid can lead to a folic acid deficiency.
Folate deficiency occurs when the body does not have enough folate. Folic acid deficiency occurs over time and caused by a diet that is low or missing in folic acid containing food. This can result in a kind of anemia known as megaloblastic anemia. Anemia caused by lack of folate is most common during pregnancy. Folic acid deficiency inhibits the immature red blood cells, resulting in anemia. 75.4% of Kelantan women knew about folic acid. Only 30.9% knew it should be taken before pregnancy. 22.4% of women did not take any multivitamin or folic acid supplements as directed. More than half of them threw out the supplements, believing that they could induce bigger infants and consequently longer labor. Only 18.2% of pregnant women and 23.9% of non-pregnant women took folic acid daily before conception. This study also found a link between married pregnant women aged 25 to 32 with better education and wealth and folic acid awareness.
Folate deficiency is associated with a variety of neurological consequences, including neuropsychiatric manifestations, insomnia, irritability, fatigue, and forgetfulness. Symptoms may vary from person to person. Some symptoms include fatigue, gray hair, oral symptoms such as sores on the tongue and inside the mouth, heart palpitations, and growth problems.
The risk factor for folic acid deficiency is it will increase risk of neural tube defect. This is happen because low folate level will prevent closure of neural tube. Folate deficiency also will cause the low birth weight and preterm baby. Next, the implication if not taking folic acid supplement during pregnancy. First, it will higher risk of neural tube defect. Then, it will cause folate deficiency, anemia in pregnancy. And the mother with anemia can get worse symptom or new symptom may appear if not taking folic acid supplement.
There are a few strategies to prevent folic acid deficiency for pregnant women. The first one is antenatal care. ANC is the care provided by the skilled healthcare professional to women throughout their pregnancy. It includes the risk identification and screening, prevention and management of pregnancy-related or concerning disease, and health education and promotion. ANC should be initiated within the first trimester of gestation with at least 4 and optimally 8 visits during the pregnancy. The screening might help to detect the early risk of folic acid deficiency, and thus the counseling might help the pregnant woman with knowledge regarding their diet or their lifestyle, and also the benefit of taking the supplement on the right time and dose. The second strategy is by consuming folic acid supplementation. According to RNI Malaysia, the recommendation of folic acid intake for pregnant women is 600 microgram per day. Women at high risk of having a child with NTD will have to take dietary supplementation with 5 mg folic acid daily prior to conception and for all other reproductive age women. 4 to 1 milligram folic acid daily for at least 2 to 3 months prior to conception and throughout the pregnancy and during the postmortem period.
Okay, for the next strategy, other than each supplement, strategy to prevent folic acid deficiency for pregnant women also can do by eating food that have higher folic acid content. Okay, what is food that higher folic acid? It recommended that healthy adult or pregnant women get at least 600 mcg of folic per day to prevent deficiency. Okay, folic is natural, present in many food, including vegetables such as dark green leaf vegetable, fruit and fruit juice, beef liver, nut, and bean operas. Okay, why is pregnant women need to get healthy food that higher in folic acid? It can help prevent some major birth defect of the baby brain like anencephaly or spina bifida. Folic acid help to embrace neutral tube that pressure to your baby brain and spinal cord to properly close. It also assists to formation baby heart and circulatory system. Okay, for this slide, it shows best food with folic acid for pregnancy. According to recommended nutrition intake or RNI for Malaysian 2005, the amount food that have folic acid that should consumer are such as spinach, asparagus, beef liver, orange, grapes, oat, white rice, cornflakes, bread, and egg. Okay, the next strategy to prevent folic acid deficiency for pregnant women by eating fortified food with folic acid. The table below show recommended nutrition intake or RNI 2070 for cereal and cereal product. Okay, what is fortified food with folic acid? Pregnant women also can get folate by eating fortified food with folic acid. Folic acid is formed to folate that can be added to food during the manufacturing process. Food that are fortified with folic acid include enriched bread, flour, pasta, rice, cornmeal, and certain fortified breakfast cereal. Okay, for the last strategy to prevent folic acid deficiency for pregnant women by eating more food. Many fruit contain folic acid, but in the table show papaya rank higher. Orange are especially higher in the vitamin. Other folate-rich fruit include grape, kiwi fruit, banana, strawberry, honeydew, and mango. The table shows recommended nutrition intake RNI for Malaysian 2070 for fruit.
In conclusion, folic acid is an easy-to-treat nutritional deficiency. Women should be more concerned of their intake of folic acid before and during pregnancy, as it is vital to protect fetus. Thus, folic acid is a superhero for pregnant women and their baby from many diseases and maintain growth development of infants successfully.